Range test. So your first job, set up a camera or get someone to film you. It will be good to look back on this session and see your development and improvement over time. Now you've got your camera all set up, we're going to get onto the runner's lunge test. To do that, one foot goes out in front. Get that knee behind you. Okay, this knee you want to keep over your heel. You don't want it going out in front. You don't want it going out too far behind. Okay, opposite hand goes down at the side. Have a nice gap between the two. And then you're going to see, can you get your elbow down to the ground? You can do a deep breath. It will help. So big breath in, big breath out. Can you get down? I'm just about getting down to the ground. Okay, so from this side, foot out in front, knee over your heel, opposite hand out, leave a bit of a gap for your arm. Back knee as far back as you can. Big breath in, big breath out. Can you get down? Just watch for that knee coming out. Okay, tends to mean there's a little bit of cheating going on in the hip because your hip wants to let it out rather than keeping it in line. Do it on both sides. Can you get your elbow all the way to the ground on both sides? And also, does it look or feel different on either side? This test will help highlight whether one side of your pelvis is struggling with hip flexion or extension, normally due to tightness. If one side gets tight, it will affect the other. Moving on to hip rotation. So we're going to do the double 4 sign. Can you get a 90 degree, 90 degree, 90 degree, 90 degree, 90 degree, 90 degree? Can you sit upright in this position, or are you having to lean? Is it really uncomfortable? Is there cramping in your butt cheek? It is normal. If you're not used to sitting in this position, it can be a challenging one. Next part of the test, can you switch to the other side without putting your hands or feet down? So can you lift them up, put them down, nice and controlled, and sit up in this position the other way around. So again, 90, 90, 90, 90, 90, 90. Can you sit in this position? Is it comfortable? Is there tightness or cramping? Are you having to lean? Is it just really unpleasant? So this is checking a lot of the rotational movement within your hips. Although we don't tend to get in this position whilst running, it highlights whether different muscles are being restricted, in particular the piriformis, which is positioned right next to the sciatic nerve, which can make it look like you've got tight hamstrings when actually is a hip issue going on that's manifesting lower down. Final range test. Okay, one leg in front and the other one behind you. So you want to point your toes behind you, have that knee as close as you can, and ideally have both those butt cheeks on the floor. So can you sit in this position? Is your leg like that? Is your butt cheek up? Can you not bend that leg that far back? Okay, you can sit on your heel and do it. I can't quite hold that position myself. And again, you want the toes facing the sky. You don't want them pointing outwards like that. Can you sit in this position? Is it comfortable? Is there cramping? Can you do it on both sides? Does one side feel different? So that feels a little bit tighter for me. As some of you know, I had ACL reconstruction. I am a little wonky. It doesn't stop me from doing what I like to do though, which is the important thing. So can you point that toe up to the sky? Can you get those knees close together? Can you get that heel backwards into your butt and toes pointing behind you? This position actually has also been linked to flat feet. So if you're struggling to hold this position and you have collapsed arches or flat feet, or you overpronate, this position is a really good one to work on and sit in to help fix that. So those are the range tests. Make sure you do the strength, core, and balance tests as well. If you can't get the range that you want, or there's an imbalance going on, I recommend sticking with the range session every day, even twice a day, to help get that range where you want it to be. So well done, crack on.